that, as a parent or as a guardian, you can get to pick up and say, hey, I think there is a miss somewhere. Yeah.
Okay, so basically, if I am to mention, if I take you back, autism happens early on in childhood. You can pick it as early as 12 months of age.
12 months.
12 months of age. That's 1 year, as early as when your child is 1 year old. And it can also delay, the symptoms can also delay in appearing up to around 18 to 24 months. That's when your child is 1.5 years or 2 years old. So basically, as I've said, because largely it's a disease that affects how your child behaves, how your child communicates, how they talk, how they socially interact with people.
Yeah.
These are the areas you will be able to focus on to pick some of the signs and symptoms. They are, to just categorize them.
Yeah.
So in terms of language and communication, you will of course notice the obvious delayed speech. You'll find some children, by the time maybe they're 1 year old, they're able to speak maybe one word like mama, tata, and depending on the child, it's not like one size fits all.
Yeah.
To all children. So there's delayed speech. You'll find some children who they're actually like some slow, like lower than normal intelligence kind of children and higher than normal intelligence kind of autistic children.
Yeah.
So this lower than normal intelligence kind of autistic children, you'll have difficulty learning. Like maybe if you take them to maybe preschool, kindergarten, they have a difficult time learning. So you'll pick up on that. There are those who have higher than normal intelligence. Yes, they'll be taught, they'll pick up things very quickly, but they have a problem like understanding what it is they're absorbing, or like communicating or using the knowledge that they have. You'll have a child
so meaning they can take on anything and absorb it.
They can absorb very fast. The ones who are higher than normal, who have higher than normal intelligence, they absorb things very fast, but the problem is they don't know how to apply whatever it is that they're learning, but they're very, very sharp. You'll have a child who is withdrawn. They usually like keeping to themselves a lot. So you'll find that they like keeping busy to themselves. They have a routine that they like following, which sometimes if you interrupt that routine, they get very upset.
Yeah.
So they like doing their own things and just withdrawing into their own corners, doing their own things. You'll find a child who is not able to take instructions. If you tell them, give me that cup, give me that plate, they're not able to follow instruction. You'll find a child who does not respond to their name.
Yeah.
Maybe you'll call them, say Lydia, they don't respond. They don't know you're referring to them. Yeah, you'll find a child who has a habit of doing some repetitive behaviors, like some just clap their hands, others just like slapping their fingers, which does not make sense. So they like doing those repetitive movements. Some of those children, and basically you find that, although this we'll talk about it later in terms of like the interventions and the therapies that we give such children. So you asked as a parent, when do you decide, okay, now let me see a doctor? So we use things like delayed milestones. You know milestones.
Yeah.
There are certain things that by a certain age a child is supposed to be doing. So by around 6 months, maybe you notice your child is not responding to you smiling at them, or they're not responding to happy expressions. That's by 6 months. You find that a child is not mimicking your expressions or your words by around 9 months. You find a child who by around 14 months, they're not able to, as I've said, to say the one words. By around 24 months, most children are able to construct at least 2-word phrases.
Absolutely.
But you find this autistic child is not able to do so. So basically things like those ones are what you look out for.
So when a parent, checks in with you, and then you get to tell them that, hey, your child now has autism. So how do you get to deal with that whole transition? Because at times parents are taken aback by that, and before they realize it, sometimes they're way too late. It's way too late for them.
Mm-hmm.
Yeah.
Yes. So I like the point you said. Sometimes it's way too late. So with autism, it's very important to capture the signs and symptoms early, because early intervention helps like the child to be able to cope better in the environment they're in, and be able to be at least somehow properly functioning kind of child, or even an adult.
Yeah.
So as a child, as a parent, when a parent comes to the hospital, first of all, there are specialists who deal with this. There are specialists like child psychiatrist, you can see a pediatric neurologist, you can see a developmental pediatrician. By the time you're coming, like maybe to me as a general practitioner, I'll assess the child and then I'll refer you to the appropriate specialist. But basically it usually just takes a toll on parents, especially emotionally, even physically, even financially. But it's just all about, you know, as you said, identifying the signs early and getting the proper therapies. There are things like behavioral therapy, speech therapy to help the child at least know how to communicate, occupational therapy to help them know how to, you know, act in social situations and things like those. And so at the point where the parent comes, where I see them, I just have to assess the child. And once I pick and diagnose that this is autism, then I refer to the specific specialists concerned.
So once you get to assess that, so for the child, which is the first session that they get to undertake? As you've said, there's behavioral and occupational as well. So which one do you start with, or do you first of all look at the stage where they're in, and then you're like, no, this one would fit on this category better?
Yes, we have first to determine at what point has the child come to hospital. You know, there are those who maybe the parent is a medic, so they know, so they'll come maybe early at 12 months. There's those who don't know, maybe they're in the village, they come maybe when the child is 3-4 years old. So I think it all depends on at the point where you have met the child. There's no really like order where you can say let's start with this and do this, because with autism there's no it's not a classic kind of thing you can say all children with autism will present A, B, C, D. It's not a one size fits all. So some children will have less severe symptoms, other children will have more severe symptoms. You know, in terms of even behavior, you'll find a child who's very aggressive, another one who's very withdrawn, they're not talking at all. So each of these children will need a special kind of intervention. You'll find a child who doesn't really need the speech therapy. They're able to talk and at least say what they want. So that one maybe won't need the speech therapy per se. You'll find a child who maybe the behavioral symptoms are not so severe, so they will not need maybe the occupational therapy. So it all depends. What are the symptoms of the child? What is the severity? At what point have they presented? Then you decide which therapy are you going to use.
So is there like a standard pay for each and every session, or do they rate differently?
For payment?
No,
now that depends on the specialist you've seen, depends on the hospital you've gone to. There's no like standard for everyone.
Okay, so maybe out there, you know, when you have a highly, you know, intelligent child, you just applaud them and you're like, my kid is so intelligent, but at the back of your mind you really don't know that your child is, you know, dealing with autism. So how could one clearly differentiate, maybe you could, if you could take us back a little bit, the difference between high intelligence and someone who has autism and is at the higher intelligence level?
So as you said, the autistic children can either have lower than normal intelligence, or higher than normal intelligence. So of course, with lower than normal intelligence, you'll pick it up. The slow learners in school, they're not able to catch up as fast as the other children. So when your child has higher than normal intelligence, yes, of course, as you said, you will be able to pick up and you're like, okay, my child is
intelligence, the genius.
So, but remember, they'll be very intelligent, yes. But as I've said, it's largely a disorder of behavior, how a child perceives and socializes with other people. So in as much as maybe they're performing well in school, they're able to grasp concepts very quickly, you will notice that in other areas of their life, they are lacking or they're behind. Like socially, as I've said, they're withdrawn. They don't want that affection. They don't like people like getting too close to them, hugging them or cuddling them. But yes, they're learning well, but they have those other kind of social to lack of a better word, awkwardness. So at that point is when you now pick it up and now decide to speak.
So at that very point, how do you get to, get them out from that high intelligence sector as a parent and, give them some occupational or rather societal skills and help them to, engage with others?
It's not really a must that they're taken out of their environment that they are just because they're autistic. There are children who are able to still go to normal schools even if they're autistic. So as I've said, once you notice that maybe the symptoms are more severe, in as much as they are highly intelligent, is when now you decide, okay, now let's do occupational therapy.
Yeah.
Let them at least know how to act. Let's do speech therapy to aid them in how they talk with other people and things like those. So they don't have to really be in a special school. They can actually be in a normal school, but so long as you have qualified professionals who understand that this child is like this and this is how you should be handled.
All right, thank you so much, Dr. Lydia, for that. Now it's time to take a very short break. We will be right back with more on matters autism. Do keep it right here.
You are watching TV 47, the home of untold stories. Disability is not only limited to physical disorder, but also mental issue. From depression,
I was under depression for 2 years.
Bipolar.
Bipolar disorder is mood disorder.
And even suicidal thoughts.
When I was just about to hang myself, a certain voice just talked to me, and I believe that was God. I tried suicide more than 6 times.
Beyond the Limit has gone beyond its limit to find answers so as to help everyone go through life with ease. Join Muthoni Maina every Saturday at 7:30 p.m. Starting this September at 8:30 p.m. on Tuesday, The Realtor brings it all to perspective. We identify a property, discuss and demonstrate the journey towards ownership.
Professionals who have integrity, and from their catalog you can easily read that these are professionals who are able to deliver.
Everywhere you go, you have to up your games, you have to go with the trends.
Not forgetting the margins as well as the risks that come along.
The runaway prices of the land. We are saying that it's something that we can never go without mentioning. Any developer will not go without mentioning the price of land.
Don't miss out. Do you want the latest news on farming? We've got
a medical facility for your child.
Okay.
Yeah.
So basically, most medical facilities, I think and I like to believe, are well equipped and able and have trained staff who will be able to handle any child who comes with autism. So basically, of course, the basic social skills are the nurses or the doctors or whoever they meet at the first point of contact. Are they able to really socialize well with the child? Are they able to understand that this is a special needs child? Because sometimes they can be also, how do I put it? They can be a bit, if maybe a receptionist is not a medically trained person and they realize maybe this child is hyperactive and they're maybe not behaving in the way that they want to behave. So is this person able to, does the person have this emotional intelligence to be able to guide the child well and talk to the parents well, not someone who will snap at the children and just what are you doing? Get out of there, you know. So we need staff who are emotionally intelligent and at least have an idea of how to deal with a child with autism who is a bit socially awkward. Yes, and of course now the specialists, before you go to any health facility, I believe you will have done your research. Does this hospital have what I mentioned, the pediatric neurologist, the child psychiatrist, the developmental pediatricians? This is where you'll be able at least to get help for your child.
So is autism hereditary or genetic?
So ideally, there's really no known cause of autism, although some studies, some research has been done that try to link autism with maybe, yes, genetics, some genetic mutations, either inherited or spontaneous mutations, but it's not cast on stone. Yeah, there's no specific known cause. Other studies also seem to suggest environmental factors to be a contributing factor to getting autism. By environmental factors, I mean things like maybe viral infections in the mother during pregnancy, things like general air pollutants, of course, that a mother can be exposed to during pregnancy, things like radiation, medication, of course, all this, a pregnant mother being exposed to these things, and others also say like complications in pregnancy. But there's no really like specifically known cause for autism.
So when it comes to medication, for a pregnant or rather an expectant woman, what are some of those medications that can lead up to autism?
There are no specific medications. As I said, it's still being researched on. There's no, like, if I can tell you, no, don't take Panadol, it will cause autism. But of course, there are those medications generally that, as doctors, we know, they are classified as class A, B, C, those teratogenic medications that we know just avoid in pregnancy, things like tetracyclines, that a doctor, if you're able to go to a hospital, a well-trained doctor will just not give you to just avoid not only autism, but many other disorders that can develop in a child after birth. Yes.
So for autism, does it particularly have to affect you, at birth, or can it now come later on at a later stage in life?
So as I mentioned in the beginning, the signs and symptoms can be seen even as early as 12 months. Yes, 12 months, but you'll find some special situations whereby a child develops, they achieve all their milestones normally, they're able to talk, they're able to do their things correctly, but at some point in their life, they lose those skills, they lose their communication skills, they lose the way they interact, just they become socially awkward. So it doesn't have to really be immediately after birth or immediately at 1 year. There are children who actually develop normally, then later on develop the autism. Yes.
So what kind of diet is, stipulated for a child with autism?
Well, that's also another topic of controversy. There's no specific diet that you can say this diet will be ultimately a good maybe treatment for my child, or this diet will be harmful to my child. Some parents, I've met parents personally who maybe say my child is on a gluten-free diet because they are autistic, or my child does not take sugar, does not take milk, but again, there are no studies to show that this food is bad or this food is good. Because ultimately you find that some parents deny children some kinds of food, and eventually that becomes harmful. The child ends up losing some nutrients which are essential for their development. Some parents also opt to give their children vitamins and supplements. There's no problem, but there's no known research that says this is good or this is bad.
So for the child that has a lower intelligence rate, so what happens, when you kick-start those training sessions for them, and maybe a child, just stays there, but there is no improvement at all. So what is done, when such a situation emerges?
We can't put an end to it and say, okay, this child is not improving, let's leave them alone. It's a process. It's a gradual process. They need a lot of support, definitely, not only during childhood, even up to into their adult years. They need a lot of support. They might even need to just be going constantly for those therapies, those speech therapies, the occupational therapies, the behavioral therapies. And of course, we can't, in as much as it's emotionally tiring or exhausting for a parent, there's no really point where you can say, okay, this one, it's a lost cause. They're not learning, they're not intelligent, let's give up. No, it's a gradual process. You have to keep supporting them gradually from childhood all the way into adulthood. So it does not stop at any one point.
So for the parents, they get to a certain point and they're like, apana, me, I won't go for those sessions. Now I'll lock up my kid in the house and that will be it for my child. So what's your advice to, such parents who tend to give up way too quickly, or they're like, no, it's eating too much into, the financial pockets of the family, so let's just stop it.
Yes. So as we said in the beginning, autism can take a toll on the family, the relatives, the caregivers, the siblings, everyone who's around the autistic child, and it's understandable. And at this point, we have to understand that care for autistic children goes above and beyond just caring for the child. It also extends to the caregivers, especially in this case, the parents, who sometimes get overwhelmed. So for parents, especially those who don't know, there are those who maybe are in the villages, they don't know, and maybe such a parent, you can come in as a relative or as a friend to be able to enlighten them. Especially when you see they're feeling tired, they're feeling like, okay, I can't do this anymore. There are a lot of support groups for parents, whether they know or not. The support groups where parents get to reach out or seek out other parents who also have autistic children, so that they get to support each other and know, okay, I'm not the only one who's going through this. There are also other parents in this, and they actually get to share ideas. They can ask, okay, when your child does this, what do you do? Me, I do this, and then it kind of helps them to cope at the point where they're at their breaking point. You can find that those support groups for parents, they get to help each other. Also, we encourage parents to read a lot around the autism and all that entails, all matters autism, because there's a lot of misconception out there. There's a lot of stereotyping and even stigma around autism. So we encourage parents to read a lot around the disease and get to understand, okay, my child is like this. When they do this, I should do this. Or when they do this, this is how I should cope. We also encourage parents to not forget themselves, to take care of themselves, to also take time off for themselves, find time to do things that you used to enjoy doing, like maybe going out on dates or going for hiking or just fun activities. Give yourself some me time, allow yourself to have me time. We have parents who maybe might feel guilty, like, why am I enjoying myself and my child is suffering? No. Just allow yourself to have me time, to recharge, and so that when you come back to your child, you're able to give them the best. And of course, lastly, not forgetting, be in constant communication with your doctor. You won't know everything. If you're not a medic, you won't be able to know everything. So be in touch with your doctor, make your doctor your friend, let them tell you when new technologies come, when new medications come about autism. All these things that I've said will be able to at least help the parent cope much better with a child with autism. Of course, when it reaches that point, you're saying maybe a parent is locking up their child in the room and okay, I don't want to deal with this anymore. That now amounts to abuse. And if you see that there's a child who's undergoing abuse, maybe their parents are abusing them because they don't understand, or they are victimizing them, then at that point I think it would be safe to involve maybe social services, so that at least for the safety of the child, so that they are not harmed.
So Dr. Lydia,
yes,
as of now, has society completely accepted matters autism as of now?
Okay, so of course we can't generalize with everyone. Personally, I can say for the patients that I deal with, most of them, at least, they're aware of autism. They've come to understand and accept that okay, so there's nothing wrong with my child per se. This is not like a curse, or people from the village. There's actually people in this day and age who, when a child starts behaving like that, they say, my child, this is witchcraft, my child is cursed, there's someone in my village looking at me badly. They don't know. But in my setup where I am, I'm glad that most of the parents that I deal with have come to accept this is autism. They know what I was talking about. They've read about it. they're well equipped. They know this is autism and this is how we're supposed to deal with it. But we still have a long way to go in terms of maybe like reaching out to people maybe who are not that privileged to have resources to understand autism. So with time, I hope we'll reach out to such people to demystify all that whole idea about autism. Yeah.
All right. Now, as we get to wind up, maybe you could share your contact for the parents that would like to reach out to you and maybe give them a recap of, you know, where you work, please, your workstation as well.
Yes.
Yeah.
Okay, so as I began by saying, Dr. Lydia Mose, I'm a medical officer. I'm based at Meridian Medical Center in Yaya Center, that's Kilimani. My contacts are 0713 074